Excellent work, folks. Excellent work. Just a few more. You know, you all are prescient because a lot of what folks have been putting in the chat for other peripheral smears is true for this one. So if I said someone from the Mediterranean, someone of African ancestry who has frequent, needs to come into the ED, unfortunately, dehydrated, in pain, we're thinking here, of course, of sickle cell anemia. And again, you know, folks were asking me earlier the difference between the helmet cells and the sickle cells. And I mentioned that the sickle cells were more elongated. Sometimes they have a little bit of a curve to them, hence sickle. Whereas the helmet cells, it truly looks more like something's got scooped out, truly evoking that helmet imagery. So absolutely, sickle cell disease. A few things that you might be tested on. In terms of the presentation, I think most folks would be able to pick this up just from the history of starting from a young age, perhaps an affected family member, the pain crises, and the autosplenectomy leading to infection with encapsulated organisms. From a basic science perspective, the sickle cell allele replaces the glutamic acid with valine. We know that hemoglobin F is protective. The therapy is hydroxyurea. But for all the heme nerds out there, there's actually been an explosion of other therapies that treat sickle cell, like voxelotor and crizanlizumab. But again, this will not show up on your examinations. And just to highlight the difference between the helmet cells and the bite cells, helmet cells often have, like when I think of a helmet, I'm thinking of like a medieval helmet, and they have like the little straps on the side. So often it'll have like two little blebs on the side that make me think of helmet cells, better known as schistocytes. Whereas bite cells, it's more like circular. It's sometimes a bit smaller, the bite, although not always. And as I've been saying, we'll see an example of something very similar to bite cells here in a moment.